And according to the Kansas Hospital Association, of those KC Metro hospitals, 45% anticipate a shortage in staffing this week.
That's almost half. Traveling nurses are some of the first to fill in when that happens. With the help of a former traveling nurse, 41 Action News reporter Andres Gutierrez shares what their work looks like.
It's very tempting to look at what's being offered.
As a former traveling nurse, Samantha Hessing says several companies reach out to her almost every day with offers to send her to hospitals who are in dire need while battling COVID-19.
There's a nursing shortage. That's never gone away. And all that's happening now is these big hospitals are providing enough cash offers to draw a vast majority of the nurses.
Though it's grueling work, the pay is quite good.
I've seen numbers anywhere from $3,600 a week up to almost $8,000 a week. That is with mandatory overtime. So some of those contracts, it is written in that you'll work 48 or 60 hours a week.
But Hessing points out the higher the amount, the shorter the contract, about 6 to 8 weeks instead of the usual 13 weeks. Some nurses found it appealing when elective surgeries went away at the onset of the pandemic.
So many things had shut down that there wasn't actually an opportunity for some of the nurses to work or get hours. And so they did. They left and took travel assignments.
At Truman Medical Centers, traveling nurses have made up about 6% of their nursing staff since COVID-19 broke out.
The ability to supplement that with agency or traveling staff is certainly helpful, but realizing that's an area that is very much in demand.
We are fortunate because we live in a metropolitan area, so we are a bigger draw for travel nurses to come to this area.
But Hessing told us not all hospital systems in the metro are as lucky.
It's causing a pretty big deficit for smaller hospitals or rural hospitals that don't have the resources to be able to offer that.
In Lenexa, Andres Gutierrez, 41 Action News.